the front page of the Atlanta Journal-Constitution today. You can see the big top story. It's a 4-column headline across the top of the front page there. Kemp set to lift restrictions. That's the top story in Georgia today, that the state's Republican Governor Brian Kemp is allowing Georgia's stay-at-home order to expire tonight, after already opening up very, very, very essential businesses like bowling alleys, tattoo parlors, salons, gyms, movie theaters, and dine-in restaurants over the past week. The governor now says that all restrictions of all kinds will be gone in 2 weeks. But then look right below the big top headline. I mean, the other big story on the front page of the AJC today, Georgia poultry workers test positive for COVID-19. Check out the lead on this story. Quote, nearly 400 workers in Georgia's prized poultry industry have tested positive for the disease caused by the coronavirus. Quote, ominous signs are popping up in Hall County, Georgia, where much of the state's poultry industry is based. Hall has the highest rate of COVID-19 cases per 100,000 residents in the region. As of Wednesday afternoon, 1,233 people in Hall had been sickened and 20 had been killed by the disease. If you want one, at least partial snapshot of Georgia today, there you have it, right next to each other on the front page of its biggest newspaper. Coronavirus outbreaks spreading rapidly through state's poultry plants, and governor says open everything back up. Everything. No restrictions. Georgia's governor has made these kinds of demands even as his state rose to 12th in the country in the number of cases and deaths, even as one of the nation's worst outbreaks hit in his state, in Albany, Georgia, and even as the city of Gainesville in Hall County, where all those poultry plants are, became the center of one of the nation's newest emerging large outbreaks. The Northeast Georgia Medical Center there projects it will not hit the peak of its coronavirus hospital admissions until the middle of June. But they expect to max out their staffing capacity at the hospital well before then, like within a matter of 3 weeks. It's hard to square what's happening in Georgia right now between the characteristics of the large epidemic in Georgia right now. And it's hard to square that with Governor Brian Kemp's insistence that everything is fine and faster than anywhere in the country. Georgia needs to open everything back up. It's hard to square those things sometimes, but then sometimes it's not that hard to square them. This is the other big news in the Georgia epidemic today. A new CDC study that finds that more than 80% of hospitalized coronavirus patients in Georgia are African American. African Americans comprise only about 30% of the population in Georgia, but they're 80% of who's been hospitalized for coronavirus in the state. And certainly the study tracks broadly with the data we've seen across the country that coronavirus is hitting Black Americans disproportionately. But over 80% of the hospitalizations in Georgia? Governor Kemp telling the Atlanta Journal-Constitution today, quote, if you weren't in the medically fragile category or someone in a long-term care facility, for most of the rest of Georgia, the effect of coronavirus has been minimal. For most of the rest of Georgia, for most, 80% of the people in hospitals are Black people. For most of Georgia, it's been minimal impact. We haven't barely noticed. It's fine as far as we're concerned. Today in Atlanta, Georgia's fantastic majority Black capital city, residents held a mock funeral procession, complete with several hearses, driving around and around past the Georgia State Capitol building. Organizers told a local NBC affiliate that, quote, death is the foreseeable result of Governor Kemp's misguided plans to fully reopen the state of Georgia. The mayor of the great city of Atlanta is going to join us live here next. Stay with us. The mayor of the great city of Atlanta, Georgia, just published this piece in the Atlantic magazine today. It's titled, Atlanta isn't ready to reopen, and neither is Georgia. Quote, as the mayor of Atlanta, I'm unable to endorse the governor's decision to reopen businesses before health experts say it's safe to do so. And the mayor makes a point about something in particular that worries her. She says, quote, we should recognize that many of the kinds of businesses that are reopening are especially popular in African-American neighborhoods, where barbershops and hair salons are ubiquitous. This concerns me because we continue to see much higher rates of infection and death occurring among African Americans than in other communities. This, of course, comes as a CDC study finds that over 80% of coronavirus hospitalizations in Georgia thus far have been African American patients. Joining us now is the mayor of Atlanta, Keisha Lance Bottoms. Madam Mayor, been really looking forward to talking to you tonight. Thank you so much for making time.
Thank you. It's great to join you.
Let me just ask you if anything that I have said in the last couple of minutes about Atlanta and about Georgia and about what's going on in your state right now, if it strikes you wrong or if you think that I've sort of got the telescope turned around the wrong way in any of this. Does this seem like a reasonable description of what's going on in your state and city?
So you're spot on, and the reality is this, Rachel. In Georgia, we beat the national average in every single category that makes this virus so much worse. Our rates of heart disease, obesity, diabetes, asthma are all above the national average. And then you layer on top of that, the African-American community is even above that. And so the fact that we are opening up businesses in this state and that we are putting the economy before the lives of people is it's baffling. And I keep searching for new words, and I can't find any because I am still completely dumbfounded that we were one of the last states to close down and yet one of the first states to open up. And the governor has said this is about the economy. And unfortunately, the people who will be the test case for whether or not we have gotten it right are the people who can least afford to be sick and are more likely to die.
I'll tell you, Madam Mayor, one of the things that I am worried about with Georgia, because it does seem like your governor is ideologically fixed on the idea of not having businesses shut down, of not enforcing stay-at-home orders. As you said, he started so late and he's ending and he's releasing these things so early. I am worried when you look at that alongside the fact that there's so little testing in Georgia. Georgia is one of the worst states in the country in terms of how much testing there is. I'm worried that he's not going to feel any pressure to try to increase testing numbers in Georgia because testing numbers might reveal bad epidemiological consequences of his policy decisions.
So our testing has increased, but it's still dismal. We are still 40th in the nation in testing. And, listen, Rachel, the reality is this. We all bring a different lens to office. So the governor was a small business owner, and I'm certain that's the lens that he brings. Well, what I bring is the daughter of a small business owner, a woman who owned a hair salon. And so I know what happens in a hair salon. There are people from the community who come into the hair salon. Many people in the hair salons don't have health insurance. They are living paycheck to paycheck. And so even if we are testing people in our communities, and this was a question that I posed to the governor, Dr. Toomey, our health leader of our health department in Georgia today, testing is a point-in-time test. And so if I test negative today and then I go out and get exposed tomorrow, it means what? And so we know that testing is just one part of this. There needs to be contact tracing. There needs to be isolation and quarantine. And there's still so much more to be done. And even when you have funeral directors saying, I've never seen anything like this before, and you couple that with the CDC, along with health professionals and even the president of the United States saying it's too soon, then I think all of those are signs that it's not the appropriate thing for us to do at this time.
I will say, looking at this from outside the state and having been sort of half in love with Atlanta my whole life, I think you're the mayor of one of the world's great cities and certainly one of the cultural hubs in America that we all have to be both thankful of and often in awe of. From outside the state looking in, one of the things that is just remarkable and inexplicable is that the governor didn't talk to you before he made any of these decisions. I know Georgia's a big state and Atlanta's just one city, but it's Atlanta. It's remarkable to me that he has been proceeding on this as if Atlanta is kind of outside the state or its own thing, or should just go along with what he says, regardless of whether or not you think what he's doing is a good idea. Has that just been a hallmark of the way he's conducted himself as governor, or has that been worse over the course of this epidemic?
No, the governor and I have had a great working relationship over the past couple of years. We obviously are from, he's a Republican, I'm a Democrat, but we've come together to work together on the things that we agree on. He did not speak with me before he lifted the first set of restrictions, but I can say the governor and I did speak on yesterday, and we have essentially agreed to disagree on this, and his staff did call today to let us know that he was going to move forward with lifting further restrictions. So that has changed since the first restrictions were lifted. But that being said, I still didn't have any input and influence because we simply don't agree on this. And so I continue to use my voice, and I'm grateful for the opportunity to talk to you and have this platform to continue to encourage people to stay home. And the reality is people are going back to work because they need money. And so that part is right. Our economy is suffering, and people are facing economic hardships. But I think this is when we step up as leaders, and we lead our community into recovery. And we make it easier for people to stay at home by making sure that those small business loans are getting into the pockets of not just the people who have well-established banking relationships, but that barber on the corner who may not have as lengthy of a credit history. We make sure that people have food on their table. These are the things that we are doing in Atlanta. These are the things that we need to be doing statewide and certainly at a national level.
Atlanta Mayor Keisha Lance Bottoms, thank you so much for taking time tonight, Mayor. I know you have a lot on your plate, and this is valuable time. Thanks for sharing some of it with us.
Thank you for having me.
All right, we'll be right back. Stay with us.